Good morning. This is the presentation for my integrative therapy video. My name is Regina Ikong, a Bradman University DNP graduate student. I am making this video to satisfy a partial requirement for my DNP program in mental health. For this video, I am going to see Mr. John King, a 25-year-old African-American male who was referred to me by his psychiatrist for therapy to help reduce his symptoms of depression. His chief complaints include depression, agitation, insomnia, and anger. History of present illness. Patient has been depressed and receiving treatment for 2 years. Patient was divorced 1 year ago with his wife granted the custody of their only child because the patient behavior was so disruptive for him to be around the child. He also was involved in a fight 6 months ago where he was stabbed on the hand, and he has since been having pain, panic attack, and depressive symptoms. His trigger for his depressive symptoms is not being able to see his daughter because his ex-wife recently got married 2 months ago and moved to another city, making it more difficult for him to see his daughter. Patient has stated that he is not suicidal and has no intention to hurt himself or others at this time. His present medications include Zoloft, Lyrica, and lisinopril. He is allergic to codeine. His medical history includes hypertension and chronic pain. Educational level. He is an artist. He has associate degree in arts. His social history. He does not drink and no drug abuse. He is a Catholic and attend church on a regular basis. And he meets his family mostly at the church because they are all Catholic. Family history. There is no history of psychiatric problem in the family. There is a strong family support for this patient, as his sister has constantly told him to see his psychiatrist to refer him for therapy so that he can work on his anger and behavior to help him function better. The patient wants to use therapy in conjunction with his medicine to control his depressive symptom, pain, and anger because his medication alone has not been able to help him very much. For this video, I have obtained a consent from my clients as this session will be videoed. I will be blending 3 therapy strategies to help my client find a solution to his problems. The 3 techniques that are most applicable in this situation are motivational interview, cognitive behavioral therapy, and interpersonal therapy. I would like to go through each and every one of them briefly. Motivational interview. This is an evidence-based method or technique for behavior modification. It has proven to be very effective in helping people change their life positively. Motivational interview specifically will enable me establish a strong rapport with my clients so that I can delve into the issues that are affecting my clients the most and help him find new ways of looking at those things. The next one is cognitive behavioral therapy. The goal of cognitive behavioral therapy is to help my clients recognize and reassess his pattern of negative thoughts and replace them with positive thoughts that closely reflect reality. The primary assumption of cognitive therapy is that thought precedes moods, and that false self-beliefs leads to negative emotions, such as depression, which is suffering now. Specifically, I will employ mindfulness-based cognitive therapy to help my clients walk through his negative feelings and disengage his mind and thought from these deep-seated issues from the past that are causing him so much pain and anger. With mindfulness therapy, my clients will learn to focus on the present and now instead of dwelling in the past or thinking of the future that is so uncertain. This exercise will help him have clarity of mind to get rid of the negative thoughts that is causing him depression, anger, and insomnia. Finally, I will incorporate interpersonal therapy. From the history, we learned that my client had a fight where he was stabbed. Interpersonal therapy will help him relate well with everyone around him. I will evaluate my client interpersonal relations as it affects him. We will work together to evaluate the problems area in his life with regard to conflict, disputes, and communication that are inhibiting him from having a good relationship with his family and friends. Motivational and interventional interpersonal therapy will help him have effective communication styles that he can work with people with. Interpersonal relationship therapy focuses on relationships and the common life stressors of loss, change, and conflict. It has been clinically proven to help treat depression effectively. Blending this with cognitive behavioral therapy and motivational interview will provide much insight for me to find a solution to my client's problem. These three techniques will enable my clients to identify problem areas so he can express his disturbing emotions in a healthy way that will improve his current relationship. So at this point, I'm going to be talking to my client. Good morning.
Good morning.
How are you today?
I'm doing well.
Can you state your name and date of birth?
My name is John King, date of birth 10/12/96.
How would you prefer me to address you?
You can call me Johnny.
Okay, Johnny. What brought you to see us today?
I have been depressed for over 1 year now, but I'm recently more depressed and feel overwhelmed with life, and I can't seem to cope too well. I'm not sleeping well, and I get angry very easily.
I'm sorry about that. Previously, we have talked about your history. You told me that you have been having a problem with depression for more than 6 months and being treated by your psychiatrist with Zoloft. Are you still taking Zoloft?
Yes, I am.
Okay, why have you sought therapy at this time?
Because I want to change my life around.
So you think talking to a therapist will help
I believe so because I've tried the Zoloft for some time now. It's not doing anything for me, so I feel I should talk to therapists.
That's good. What are your thoughts about depression?
I want to be able to do things I used to do, go to parties, see families, and most importantly, I want to be able to see my ex-wife and not be so angry, so I can have a better relationship with my daughter.
You have also mentioned previously that you were closer to your ex-wife and daughter. What changed that?
She got married last month and moved to a different city, which makes it harder for me to see my daughter because the long distance traveling back and forth affects my situation.
Okay. There is something about this transition that has been very difficult with the relationship with your daughter. This must be very painful for you.
Yes, it is so. I love my daughter very much, and it's very difficult for me to travel so far to see her. So each time I have been to see her, I got very angry at my ex-wife, and this anger interferes with the relationship with my new girlfriend because I'm always angry.
I see. If I may ask, Johnny, are you in any way affected by your ex-wife's new marriage or new relationship?
No, no, not at all. I, I love my new girlfriend, but not being able to see my daughter affects me so much. I cannot function properly. What bothers me is what bothers me is that I worry about what people will think of me as a father. I also worry about what my daughter will think of me in the future if I am not there for her.
Okay, so you feel that the depression is affecting your relationships. Which relationship is it affecting the most?
The most house is the relationship between me and my ex-wife.
Okay, this is exactly the issue of interest to me. Maintaining a good relationship, communicating effectively with everyone around you will help you have a good relationship with others and bring you some happiness. I will be examining these important relationships with you and try to find ways of bringing your loved ones closer to you, even if they are so far away. I think that we will be able to make some positive changes that will point you to the right direction in attaining your goal. Now that we have a goal, which is to develop a better attitude, so we have agreed that you need a better attitude to deal with people to get good results.
Yes.
So we can better relate to your loved ones. We need to make sure that you are fully ready for the change, because it is when you fully prepared to receive to change, that is when change can come. That commitment will come when you are fully ready. So to find out about your readiness for this change, I'd like to ask you to tell me, on a scale of 1 to 10, 1 being the lowest and 10 being the highest, how ready are you for a change at this time?
I'm ready for the change. My number will be 7 on the scale.
7? That's a pretty high number on the readiness scale. Why did you choose 7 instead of a 4 or a 5?
I really feel that it is time for me to start doing something positive to improve myself and the ways that I interact with people. I want to start doing something positive to change my situation for good. I feel hopeless that I can not see my daughter because of my anger. At this time, I'm willing to do anything to change it.
I really would like to change your emotion of hopelessness to hope. That's, I would like to work with you to change your negative thoughts of hopelessness to hope. I'll be using the Cope Manual, a very creative program that has proven to help young people like you to make positive change in their life. I have a copy of the teen manual here. This is COPE, Creating Opportunity for Personal Empowerment. It's a cognitive behavioral skill building program that will help you build yourself to make changes. On session 1, as you can see, everyone has a certain amount of stress and has to deal with difficult times in their life, which is what you're going through. But making a choice to deal with these things in a positive way will help you to feel good about yourself. When you think positively, you will be happier and have less stress. How you think affects how you feel and how you behave. So over the course of our therapy, we'll be referring to this session all the time, this page 1. The thinking, feeling, behaving triangle. The way you think affects how you feel, and it affects how you behave. Many times, there is a trigger event that starts the negative thinking. In your case, it's not being able to see your child. And becoming aware of how you think is important so that you can help your thinking to be more positive. Are we on the same page?
Yes, ma'am. Yes.
Okay. So, we have talked about page 1. And I'd like for you to take a moment and look also at page 7 and tell me what you think. By the way, I'm going to give you this, you're going to have one of these books so you can work on, because we will have a lot of exercises for you to work at home.
Okay.
On page 7, you have, this program will help you to stop those automatic negative thoughts and turn them around so that your emotions, consequences are more positive. It says positive thinking brings about positive action, brings about positive habits, and brings about positive results. The more you think positively, the more you will get good results. And the more you think negatively, the more you get negative results. So I want you to look at that for a moment. Okay, just looking at it, what do you feel? What do you think about it?
The picture is explaining all we have been saying, that when we think positively, our actions and habits are positive, and we will end up having positive results. That is what I would like my life to be like at this time.
That is good. It looks like we have made a progress on this session, a great progress, not just a progress. We shall end this session with some homework assignment to prepare you for the next session. If I may ask, what are the things that you enjoy doing that you have not been doing because of your depression?
I like exercising, I like artwork, painting, I like music, but I've not done any of this because of my state of mind. I don't have the aptitude to do anything. I'm very depressed. I'm clouded with these thoughts of not seeing my daughter and not having a better relationship with my ex-wife. So I'm just wondering how I can get myself out of this situation.
I'm sure we'll be able to help you make a headway with all that we are going to do. I'd like for you to work on pages 8. This is going to be your homework. Pages 8. And let me go through page 8 a little bit. One way to do this is to practice positive self-talk. Positive self-talk is one way to begin to change your negative thinking. Positive self-talk helps you to focus your thoughts on words of encouragement, praise, and support. Example of positive self-talk: I am a trusted friend. I did that well. I am not going to give up. I am going to stay calm. This won't last forever. I am in control of my feeling. I'm going to prepare more next time. So, with that, if you continue talking positively and on page, your outcome will be different from what it was. Because when you are not very angry, there'll be no point for you to fight, to hit someone or someone hit you. You have self-control. Isn't that so?
It's so, but sometimes I cannot think right. Your thoughts just overwhelms me. I cannot reason, so I don't know. I don't know how to go about all those.
This program will help you, I'm sure. Like I said, it has helped many young people. We just need to work on it and bring you to that point, okay? And so on page 13, this is going to be your homework. Think about something that you say to yourself on a regular basis that is negative statement. For example, I see that you said you are worried about what people will think of you as a father, and you worry about what your daughter will think of you tomorrow. One aspect of cognitive behavioral therapy says you should look at today, look at now. Don't worry about the past. You cannot change the past. Don't worry about future. It's too far away. You can't do anything, but you have control of now. So now you can do something to change the situation. So I want you to write the negative statement and change it to what you want your positive statement to be. All those negative thoughts that you have in your mind, write it down and then change it, put it, and then verbalize them and talk about them until we come back next time. And so I want to ensure that you do one of the exercises, one of those activities that you love doing, which you have not been doing. I see that you're an artist, you draw, painting and all that. You like exercising and you love music. So one of those, engage in them and work on them and see how your attitude will change. And so we will see you in a few days. And thank you for letting me work with you.
Thank you for working with me.
Okay, thank you.